Hey Warriors, welcome back to Empowerment and Illness. I am your host, Quinn, and I'm glad you're here. If you've been diagnosed with lupus, you've probably noticed something pretty quickly. There isn't one lupus pill, there isn't one treatment plan, and there definitely isn't one medication that works for everyone. Over the years, I've taken different medications, adjusted treatments, celebrated when something worked, and dealt with the disappointment when something didn't. If you've ever looked at your medication list and wondered, why am I taking all of these? Today's episode is for you. Before we get started, I want to be very clear. I'm not a doctor, and this episode isn't medical advice. I'm sharing information to help you better understand the medications commonly used to treat lupus. Your lupus treatment plan is unique to you, so always discuss medication, benefits, risks, and side effects with your healthcare team before making any changes. Let's get into it. When I was first diagnosed with lupus, I remember looking at those prescription bottles and thinking, why am I taking so many medications? Maybe some of you have wondered the same thing. I had one disease, so in my mind, I thought I should have one medication. It seemed simple enough, but lupus quickly taught me it doesn't work that way. One of the things I've learned over the years is that my lupus isn't your lupus, and your lupus isn't mine. We may share the same diagnosis, but our symptoms, our organs affected, or even our treatment plan can look completely different. That's why two people with lupus can compare medications and discover they're taking very different things. The best way I can describe it is to think of your medication like a toolbox. Every tool has a purpose. Some medications help calm the immune system. Some reduce inflammation. Others are there to help protect your organs or prevent long-term damage. Your healthcare team isn't just handing you a bunch of prescriptions. They're choosing the tools they believe your body needs. As we go through today's episode, I don't want you to focus on whether you're taking the right medication. That's a conversation for you and your healthcare team. Instead, I want you to understand why these medications exist and the role each one can play in treating lupus. Let's start with one of the medications that many of us have probably heard of, Plaquenil. Plaquenil, also known as hydroxychloroquine, is often considered the foundation of lupus treatment. I've been taking Plaquenil for over 30 years. That's a long time to take any medication. And if you're like me, there have been times when you've wondered, is this really doing anything? The funny thing about Plaquenil is that it doesn't usually make you feel dramatically better overnight. It's one of those medications that's quietly working in the background. I remember one conversation with my rheumatologist that has stayed with me all these years. He looked at me and said, Plaquenil is one of the reasons you're still alive. Those are words you don't forget. He explained that Plaquenil wasn't just helping me with my lupus symptoms. It was helping reduce my risk of blood clots and helping minimize lupus flares. That conversation completely changed how I looked at this medication. It wasn't just another pill to take every day. It was an important part of keeping me healthy over the long term. That doesn't mean Plaquenil is the right medication for everyone, and it doesn't mean everyone will have the same experience I have. But it does remind us that sometimes the medication we don't feel working are doing some of the most important work behind the scenes. Like every medication, Plaquenil has potential side effects. One of the things your doctor will probably recommend is regular eye exams while you're taking it. Those appointments are an important part of making sure the medication continues to be safe for you. For me, taking Plaquenil has become part of my daily routine. I don't think of it as just another prescription anymore. I think of it as one of the tools that has helped me continue living my life for more than 3 decades with lupus. And that's really the takeaway. Plaquenil isn't designed to work alone or solve every symptom. It's one tool in the toolbox, but for many of us, it's an important one. Now, let's talk about the medication that many people with lupus have a love-hate relationship with, prednisone. Prednisone has helped me through some of my worst lupus flares. When my body was in full attack mode, it helped calm the inflammation and gave me relief when I needed it most. There have been times when I was incredibly grateful that it existed. But if you've taken prednisone for any length of time, you also know it comes with a price. For me, the price has included weight gain, trouble sleeping, and changes in how I look. it has also turned me into the bionic woman. I know many of you have your own stories. Maybe your face became rounder. Maybe your appetite seems impossible to control. Maybe you found yourself awake at 2 a.m. in the morning cleaning the house because you couldn't sleep. Prednisone isn't usually meant to be a forever medication. My doctor has always tried to keep me on the lowest dose possible because long-term use can increase the risk of side effects like osteoporosis, cataract, high blood sugar, high blood pressure, and other health problems. That's why you often hear doctors talk about tapering the dose instead of stopping it suddenly. I currently take 5 milligrams every day, and that's a decision my healthcare team and I have made based on my lupus. Your treatment plan may look completely different, and that's okay. The goal is to find the lowest effective dose that keeps your disease under control. If Plaquenil is the medication quietly working in the background, I think of prednisone as the firefighter. When inflammation flares up, prednisone is often the medication that rushes in to help put out the fire. The challenge is that while it's doing that important job, it can also affect other parts of your body. That's why doctors try to use it carefully and monitor you closely. Prednisone has probably been the medication I've complained about the most over the years. In fact, some of you may remember my t-shirt says, Prednisone, devil in a blue dress. I laugh about it now, but anyone who's taken prednisone understands the humor behind it. Even with all of its challenges, I'm grateful it's available. There have been times in my life when I truly needed it. Like many lupus medication, prednisone isn't perfect, but when it's used thoughtfully and monitored carefully, it can be an incredible important tool in managing this disease. Now, let's talk about immunosuppressants. I have to admit, the name alone can be a little scary. When my doctors first mentioned them, I thought, why would I want to suppress my immune system? It sounds like I would be making myself sick, right? Then my doctor explained that my immune system wasn't too weak, it was too active. Instead of protecting my body, it had become confused and was attacking healthy tissue. The goal wasn't to turn my immune system off, it was to quiet it down enough to stop it from attacking me. That's where immunosuppressant comes in. Depending on your lupus, your doctor may prescribe medication like Imuran, Celsip, methotrexate, or others. Not everyone with lupus needs these medications. It really depends on what lupus is affecting in your body. For some people, they're used to help protect major organs like the kidneys, lungs, or brain. If you're taking an immunosuppressant, you probably notice your doctor ordered blood work on a regular basis. Mine certainly did. Those lab appointments weren't there to inconvenience me. They were there to make sure the medication was doing what it was supposed to do and that my body was tolerating it well. Because these medications calm the immune system, your body may have a harder time fighting infection. That's why your doctor may remind you to wash your hands, avoid being around people who are sick, or call the office if you develop a fever or a sign of an infection. Like every medication we've talked about today, immunosuppressants have benefits and risks. They aren't prescribed casually. Your healthcare teams considers your symptoms, your lab work, and which organs are involved before deciding if they're the right choice for you. For many people living with lupus, these medications play an important role in protecting the body from long-term damage. They're another tool in the toolbox, chosen for a very specific reason. Another treatment option your rheumatologist may talk to you about is biologics. If you've been living with lupus for a while, you may have heard names like Benlysta or Sapinello. These medications are a little different from the others we've talked about because they're designed to target specific parts of the immune system that contributes to lupus. When I was first diagnosed over 30 years ago, biologics weren't part of the conversation. They simply weren't available. Today, people living with lupus have treatment options that didn't exist when I began this journey. That's encouraging because it shows that research is moving forward. That doesn't mean biologics are for everyone. Some people do very well on medications like Plaquenil and never need one. Others may continue having flares even after trying several medications, and that's when a biologic may become part of the discussion with their rheumatologist. One thing I appreciate is that we have more choices than we used to. Lupus isn't a one-size-fits-all disease. So it makes sense that treatment isn't one size fits all either. What works well for one person may not work for someone else, and sometimes it takes patience to find the right combination. If your doctor recommends a biologic, don't be afraid to ask questions. Why this medication? How does it work? What side effects should I watch for? How long will it take before we know if it's helping? Those are all reasonable questions, and understanding your treatment plan can help you feel more confident about it. The biggest takeaway from today's episode is this. Every medication we've talked about has a different job. Plaquenil, prednisone, immunosuppressants, and biologics aren't competing with one another. They're different tools your healthcare team may use to help manage lupus. And while medications are an important part of treatment, they're only one part of the picture. Regular follow-up appointments, lab work, listening to your body, and working closely with your healthcare team are just as important as what's inside the prescription bottle. The last group of medications I want to mention are the ones that help us manage the symptoms of lupus. These aren't medications that treat lupus itself. Instead, they're there to help us function a little better from day to day. Let's face it, lupus can come with a lot of unwelcome companions: joint pain, muscle aches, headaches, nerve pain, fatigue, dry eyes, dry mouth. The list can be long. Depending on what you're experiencing, your doctor may recommend medications to help relieve those symptoms. For example, some people take anti-inflammatory medication for pain. Others may take medication for nerve pain, antidepressants that also help with chronic pain, eye drops for severe dry eyes, or a treatment to help with dry mouth. If lupus affects your kidneys or blood pressure, you may be prescribed medication for those conditions as well. Treating lupus isn't just about calming the immune system. It's also about improving your quality of life. If you're in pain all day or your eyes are so dry you can barely see, these symptoms matter. They deserve attention too. I think it's important to remember that taking a medication for symptom relief doesn't mean you've failed or that your lupus is getting worse. It simply means you and your healthcare team are treating the whole person, not just the disease. When I look at all of my medications today, I don't see a collection of pill bottles anymore. I see a treatment plan. Every medication has a purpose, and together they're helping me continue to live my life with lupus. That's really the message I hope you take away from today's episode. Ask questions, understand why you're taking each medication, and never be afraid to have an open conversation with your healthcare team. The more you understand your treatment plan, the more confident you'll feel in managing your lupus. Before we close, I want to leave you with something practical. One of the best things you can do is become an active partner in your healthcare. That doesn't mean you have to know everything about lupus. It simply means you should feel comfortable asking questions and understanding your treatment plan. For years, I would leave my appointment and think of all the questions I forgot to ask. By the time my next appointment came around, I'd either forgotten them or convinced myself they weren't important. Now I keep a running list of questions so I'm prepared when I see my doctor. Here are a few questions you might consider asking. What is this medication supposed to do? How long will it take before I know if it's working? What side effects should I look for? Do I need routine lab work or other monitoring? Are there foods, supplements, and other medications I should avoid? What should I do if I miss a dose? When should I call your office instead of waiting until my next appointment? Those questions may seem simple, but the answers can help you feel more confident about your treatment plan. I also want to encourage you to be honest with your healthcare team. If you're having side effects, tell them. If you can't afford your medication, tell them. If you're forgetting doses or you're concerned about taking another prescription, tell them. Your doctor can't help solve a problem they don't know exists. Your appointments aren't just for your doctor to ask questions. They're also an opportunity for you to ask yours. The more you understand your treatment plan, the more prepared you'll be to manage lupus one day at a time. Set aside some quiet time this week with your journal. These prompts are meant to help you notice your direction, not judge your pace. What medication do I take that I understand the least? And what questions do I want to ask my healthcare team about it? How has my relationship with my medications changed since I was first diagnosed with lupus? What is one thing I learned today that helps me feel more informed or more confident about managing my lupus? Understanding your treatment plan isn't about becoming your own doctor. It's about becoming an informed partner in your care. The more you understand the purpose behind each medication, the more empowered you feel when making decisions alongside your healthcare team. For our listeners' action plan, this week we're asking you to take 3 practical steps toward becoming a more informed partner in your lupus care. Step 1. Make a list of every medication, vitamin, and supplement you currently take. Next to each one, write down what you believe it's for. If there are any you're unsure about, put a question mark beside them and ask your healthcare provider at your next appointment. Step 2. Write down at least 3 questions you'd like to ask your healthcare team. Don't rely on your memory. Keep the list on your phone, in a notebook, or in the paper trail, so you'll have it with you at your next visit. Step 3. Never stop taking or changing your medication without first talking to your healthcare provider. If you're experiencing side effects, have concerns, or simply don't understand why you're taking something, start the conversation. Your healthcare team is there to help you make informed decisions, not to make them for you. Knowledge is one of the most powerful tools you have. The more you understand your treatment plan, the more confident you'll become in managing your lupus one day at a time. And now, a word from our sponsor. This episode is sponsored by The Paper Trail, created by Empowerment and Illness. If today's episode made you realize you're not exactly sure why you're taking every medication, you're not alone. Understanding your treatment plan starts with staying organized and keeping good records. The Paper Trail was created to help you track your medication, dosage changes, lab results, side effects, and questions for your health team. It gives you one place to keep the information that matters most, so you don't have to rely on memory during your appointments. I can't tell you how many times I've left a doctor appointment and remembered a question the moment I got in the car. If you've ever done that, the Paper Trail was designed with you in mind. Write your questions down as you think of them. Take them to your appointment and leave feeling more informed and prepared. To learn more about the Paper Trail and the other resources available through Empowerment and Illness, visit our online store. Be prepared. Don't panic. And now, back to the show. Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow. Give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you've reached 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When we hear about the passing of someone, they have the day they were born and the day they pass away. There's a dash in the middle. It's not a long line, but a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. Thank you for spending part of your day with me. I hope today's conversation helped you better understand the different medication used to treat lupus and reminded you that every treatment plan is as unique as the person living with the disease. Today's episode was all about clarity. The more you understand your medication and the reasons you're taking them, the more confident you'll feel when talking with your healthcare team and making decisions about your care. Clarity is the first step toward empowerment. If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could use a little encouragement or information today. Your support helps Empowerment and Illness reach more people living with chronic conditions. Until next time, this is Gwen reminding you that chronic illness may be part of your story, but it does not define your future. Remember, you have the strength, the heart, and the support to continue your journey. Be safe.